research project. My name is Lauren Reames, Practice Manager for Chenal Valley Animal Hospital. I will be walking us through a people-related business challenge that has come to affect us in our everyday business ventures. This challenge affects us in a fiscal, social, and quantitative way. While we have seen numerous challenges as a veterinary practice, particularly through COVID, curbside service, death of leadership, and leadership changes, this challenge has remained present throughout all of them. This tells me that our challenge is something that needs individual attention and addressing. Our business challenge is that we are losing 50% of our employees to other veterinary clinics every 3 months. Employee retention is vital to a fully functional hospital as it allows for continuous care, client relationships to be built, and training to be effective and constantly built upon. Our poor retention has been an ongoing issue since 2019. However, the number of employees leaving our workplace has doubled since COVID. Each member of our staff is essential to our business and to making our clinic turn a profit, let alone make a break-even amount. Since I was onboarded as the practice manager in 2021, we have seen an entire staff turnover, doctors depart, and our revenue has taken a deep plummet. Because of this, we have not been able to give bonuses, provide lasting care, and have lost numerous clients due to the appearance of unhappy and uncontented staff and/or lack of fully trained staff. Recognizing this as a significant problem, our team has been motivated and challenged to understand why this is happening and what we can do to fix it so that we have a successful practice again. As Little Rock has such a large amount of veterinary practices in the area, we are at a disadvantage for the opportunities that are offered elsewhere. Because of the pool of different benefits that other clinics give, we must be able to keep up with and constantly focus on improving workplace for our employees so that they will thrive and stay with us. So why should you, as the business owner, care if your employees are happy? If we have unhappy employees with poor retention, our quality of care decreases drastically. In the past 7 months, we've seen an increase in patient care mistakes, with one resulting in a patient death and a board complaint. Spent a total of $5,923 on training new hires, with little to no return on investment and a 57% decrease in client satisfaction. We've also seen our gross revenue drop an entire 18% in the last 3 months, bringing our net revenue down to a break even on the good months and a loss in our traditionally slower months. When we are not able to provide the amount of staff needed to meet the benchmarks provided by our corporate overhead, we end up with mistakes with our quality of care. Namely, we have had medications be administered to pets that looked similar, appointments missed because we were not able to see them in the time provided, and an increase in wait times for our clients. An increase in these wait times means that we have sick patients in rooms that are unable to be treated in the proper time needed. While we do function on a triage basis, if we have multiple level 1 emergencies that come in through our doors, we cannot possibly see them all at the same time, as we do not have the technicians or the doctors. Additionally, while trying to function with the staff that we currently have, our overtime has exceeded the usual parameters by over 59% this quarter due to trying to meet the demands for our doctors. Having this shortage also creates a lower revenue met as we are unable to see the amount of patients necessary. This means that we are unable to provide things such as expensive gold standard medication. We are unable to pay our bills on time and unable to extend employee benefits to the fullest amount possible. This creates stress when it comes to providing raises, looking into employee benefits, and utilizing training tools that allow us to not consistently pull current technicians off of the floor. Our employee retention rate also creates a social issue. Due to the amount of veterinary technicians and assistants in Little Rock, word of mouth labels us as a clinic to avoid due to various reasons. This in turn means that we are having a slower hiring time and having significant issues with creating positive attitudes and therefore a good work environment. We have since become a clinic that surrounding clinics target to poach employees. Additionally, we have also experienced the Little Rock area suffering as we cannot possibly see the amount of exotic animal patients needed. With Dr. Sarah Klein and Dr. Irene Tolschachter being the only exotic animal doctors in the central Arkansas area, we have a plethora of clients that bring their animals to see them, even referrals that are given by other hospitals. This has certainly become our niche and what we have been known for. With Dr. Klein's connections as a previous Little Rock Zoo veterinarian and Dr. Tolschachter's 10 years at Pinnacle Valley Animal Hospital, they bring a high amount of clients over with them and patients with extreme medical issues that are hard to treat. While Memphis, Tennessee is the nearest exotic animal location, aside from ours, many clients do not have the option to drive 2 hours as the response time for an exotic animal typically falls within the 60-minute mark. Our inability to meet the demand needed for exotic animals leaves Little Rock in a deficit of care all around, but these are by far the most notable aspects. Our research team that we compiled begins with the medical director, who has been a veterinarian for over 10 years. She has previous management experience at the Little Rock Zoo and has been a medical director for over 5 years. As partner to the practice manager, she is knowledgeable about all business aspects and how they tie in with the medical aspects of the business. Next is our lead technician, who oversees the technicians and their day-to-day tasks, helps with the scheduling, delegating patient care tasks, and helping with inventory and ordering. Our lead receptionist, who is the supervisor and will be able to attest to the client demand and the struggle that we are currently having in seeing every patient needed. Finally, our practice manager, who runs our business daily, makes the schedule, does the purchasing and ordering, speaks and addresses client concerns, works with the medical director to problem shoot any care discrepancies, and works within our budgets. She understands best practices about how to work within the confines of allowances that we are given every day. When discussing what causations were behind the loss of our employees, several hypotheses were proposed. We have narrowed them down into the most succinct and informative possible. When looking into our benefits package, we discussed whether it would be beneficial or not to offer more competitive pay and a benefits package. We looked at the average pay of different clinics within a 30-mile radius, as this is also the average commute distance for our employees. We looked at what the most needed benefit for the team is. To achieve these numbers, we surveyed both the surrounding clinics and conducted an employee survey. We also used a criterion of our turnover rate, which was taken from our HR portal. For the clinic pay, compared the average pay of clinics in the surrounding area and added up the amount of raises that had been given to our employees. For the benefits package, we used an employee survey to ask what the wanted benefits were, ranked them in order of what was most desired, and made predictions on how offering our benefit package would affect our revenue. Both of these hypotheses use one sample t-test. For our next hypothesis, we looked into if it would be beneficial to have a cap on the amount of patient to technician ratios. We used the current average number of cases seen daily by pulling this information from our practice information management software and compared it to the working hours needed to maintain the amount of patients seen within a normal time. As we are turning patients away each day, our lead receptionist also kept a list of how many cases we sent to other hospitals so that we could factor them into this number. This ratio was measured in a percentage for us. We also looked into how honoring titles would impact our team. We looked at how many CVTs are working within a 30-mile radius of this clinic by receiving this information from the current state board and compared it to the other clinics honoring titles. We used a one sample t-test for this. In conclusion, it is important to keep in mind the immense need that we have for our hospital to succeed. We are losing revenue at a rapid amount by not being able to keep technicians, and with the current technician shortage, this is becoming a state of emergency for our clinic, for a lack of a better phrase. I do hope that this will influence you to look at these numbers and make the decision that will most benefit the hospital. Thank you.